Good morning, MED240, rocking some meds from the Delta to the DMV. My name is Dr. Nelson Garais, and it is week 5, and February 4 is the lecture for this week 5. So if we go down, and the topic, they missed some topics for week 5, but a good thing is to go over some items of the exam. I just realized that there's no lecture. I just want to make sure if everything looks good. Yep. So there's no lecture, there's nothing going on. I'm going to give you guys a break, but try looking at the lecture notes for next week, which is analgesics and narcotics. And I guess you could, there's no homework, but of course there's study question quizzes. So let's look at the exam. Okay. Now, as of today and tomorrow is the 6th, I believe, or I'm recording it for a Thursday class on the 4th, but today is actually the 5th, and grades are due 12 noon, Saturday, February 6th. So everyone who's at this time, everyone who's, and also you could see if you handed it so late that it's like 2 days already, you're already gonna get a very, very low grade. But hey, give me a call if you missed it. I believe only 2 of you missed the exam, so okay, hope you give me a call. So let's look at this online version of this exam, and you'll see it'll mimic the things that I essentially was talking about during lecture, and also the PowerPoints and a lot of the items that Dr. Cisco also put on her exam. So if you look at this, the first 2 questions is a pharmacokinetics versus a pharmacodynamics. Wow, I already got a typo right here. Now, I could give you the answer, but review um, what pharmacokinetics is what the body does to the drug, and pharmacodynamics is what the drug does to the body. So what the body does to the drug, think, absorption, bioavailability, motility, and elimination, right? Those are pharmacokinetics. Pharmacodynamics are like mechanisms of action and things of that matter. Number 3, following doses of drug. Now the key is before, okay? So let's look at some of these doses. Prophylactic dose or prophylactic use of medications is if you remember your medical terminology, is before the patient has any pathologies. And a classic example is pre-surgical protocols. Now, your ED or your efficacious dose or dosage of efficacy is the dose at which, or the strength of the drug at which it works, right? Like for a 70 kilogram male, acetaminophen is what? Anywhere from 900 milligrams to 1,000 grams or a gram every 4 to 6 hours. That anything less than that, the drug won't work for that patient. Now, efficacious doses are the dose at where it works. Therapeutic dose is just it's just semantics at this point, but ED is the more important one. Now, you also have TD, which is the toxic dose, the dose at which it starts causing some real serious side effects and real serious damage. Okay, but therapeutic dose, it's semi made up. Subclinical dose, that wasn't in the lecture, and these other stuff, ED, TD, and prophylactic dose. Now, the other kind of dosaging schedule that we also talked about was loading doses versus maintenance dose. Now, one of the classic examples that we used in class was tetracycline. If you and other antibiotics. Like the first dose is like a wallop, right? Is a bigger dose to get over the bioavailability and get over the pharmacokinetics of your body, and then the rest is maintenance, right? So let's say, for example, you're given like 50 milligram loading dose, and then that's for the first day, and then the next 3 to 4 days later, it'll be like 20 to 30. And those are the kind of dosages that you should be thinking about, right? Physiological foxglove. Remember we talked about digoxin, so it's of course cardiac effects, and of course digoxin toxicity is also cardiac effects as well. The phases we all know. One, you'll never is no prescription. Two, threes, and fours. Those are prescriptions, with two being the highest, four being the lowest. Remember the difference between DEA and the FDA. FDA is the Food and Drug Administration, but the DEA deals with drugs that are controlled substances, or these up here. Okay. All right, so those are straightforward. This is a straightforward question. Which of the drugs sublingually? Remember we talked about first pass effect and how the certain medications get by the first pass effect. And one of those medications that we talked about in lecture was nitroglycerin, which is that tiny little white pill used for angina/chest pain. The other example we used are parenteral medications, and those are all the injections that we talked about, which, by the way, I'll be posting up the laboratory or the on-the-ground classes, which is week 8, week 9, week 10. We are currently at week 5. Next week, we're going into week 6, so it's coming up pretty fast. And you could see how the terms go by very, very quickly. All right, so heads up and pay attention, gang. This one's straightforward. I should actually just fail you if you didn't get this. How many times we mentioned Tylenol and acetaminophen and the different kinds of names and its main drug. Another typo. Affinity. Remember I talked about what we're looking at regarding cancers and viruses, their affinity or their stickiness strength. Terms: antagonist and agonist, synergist. You should know those terms. That's pretty much straightforward. Anaphylaxis. Remember we talked about that. And it's not deadline, it's deadly. What is with me and typos? You know what? I'm going to start fixing my typos. What was the other one? Pharmacokinetics and psychotropic. Yeah. Pharmacological. Okay. Which of the following drugs are HIV? Remember, HIV dealt with anything reverse transcriptase, right? NRTIs, NTIs. No MRSA, VERSA, that's straightforward. Mechanism action of tetracycline. Let's fix the spacing on this. You guys, come on, you should know that. Okay. Which is the broad spectrum? Those the first two. I remember we talked about amoxicillin, ampicillin, right? They kill a whole bunch of broad spectrum, meaning everything under the rainbow. Vancomycin, it is nephro toxicity. I just wanted to see who's really studying on number 23. That's like super specific, but again, the rest of it is pretty straightforward. But I just wanted to see who's going the full 100 yards. What is the function of bacteriostatic? Remember, stasis, they're not going to kill, they're preventing growth, just like the antivirals. Method of action, macrolides, that's straightforward. Amphotericin B, very important. That's also straightforward. Antifungal. RX, straightforward, right? The parts of the prescription, I don't have to go over that. very straightforward. But for those of you preparing for the AMT exam, NHA, the CCMA, or the what's the other one, RMA, these questions come out, and so do these big time. The abbreviations: PRN as needed, BID twice a day, or BIS in DA, TRIS in DA, and I forgot what Q is, but Q I remember: quad, and a quadcopter has 4 helicopter blades, a quad, one of those ATV things, has 4 wheels, so it's 4 times a day. Corticosteroids, we know what they do. Um, they they have immune effects, and its function is to decrease what do you call that? Um, your non-specific inflammatory response. Okay, so it'll do a number on your immune system. So it will decrease your immune response, which is in specific your inflammatory. That's why steroids are really good for like asthma. They're really good for um, joint disease and anything that causes inflammatory, like the arthritides. So that's a good thing to have. Right strength, right drug. That's easy. Um, Inhaler. That's method of route of administration is aerosol. Reading this is easy. Antibiotic. Route of administration of the above drug is, of course, oral. Right. It even says it right here. It's in an oral suspension. And remember, if it's in suspension, read. Well, this is blurry right here, or it probably is clear, but my glasses aren't too great. But remember, I mean, watch your labels. If it says to shake, it says where to store. You got to pay attention to that. Parenteral, that's easy. That's all of them. And we're going to be going over that in lab and hitting that up with the simulator pads on how to do this. And remember, what's the fastest? IV. It goes right in the vein. Remember I told a story about all those heroin addicts? Remember my patients in lovely New York City? What classification of drugs is amoxicillin, ampicillin? Of course, broad spectrum. Mechanism of action of quinolones, hint, hint. Penicillins, hint, hint. You guys should know these. These are very straightforward. What are the causes of antimicrobial resistance? Of course, if you use antibiotics too much, or you misuse them, you use them when you don't need them. Remember the story I talked about, how you don't give it to somebody who has a virus, because viruses are, I mean, common cold is 9 times out of 10, not 9 times out, it's caused by a virus, and it's usually self-limiting. So if you give antibiotics to that patient, you're actually going to give them a super infection somewhere down the road. Which of the following is an example of a sulfonamide? Remember, the most common, cotrimox. What is the most common side effect of antibiotics? That's easy, GI effects. You should know what nystatin is, mycostatin. It's right there. Myco, antifungal. Remember, again, how your basic 100 level class medical terminology can save you in a lot of questions. Most common side effect of antifungal that we talked about was hepatotoxicity. Which of the following is antiviral, right? Remember, it's cyclovir. See that has a little note. ASA is aspirin, AZT. Maybe 47 no, not might be, definitely is a bonus. You can either answer B or D. Slipped up there. But Coumadin is it's an anti platelet medication, right? Like warfarin, and we're going to talk more about that in the weeks to come. Which of the following is the most common antiviral, right? For HIV, we talked about the cocktail. That's the answer right there. What is the main mechanism of action of antiviral medication? Remember, they don't kill anything. They stop or prevent viral replication. And that's the most important MOA of your antivirals. And last but not least, a protease inhibitor like ritonavir, also known as Norvir, Because what's it for? And of course, here you go. That's the best answer. Okay. So going over that, I know I went quickly, but this is a video. You can stop it, or you can pause, and that's the exam. Now, what are we going to be doing in what are we going to be doing in laboratory? Well, let me tell you. Um, there is no official laboratory for this class, but week 8, week 9, week 10 is what do you call that? Mandatory that we uh, um, well, I'm going to reserve week 10 for makeup, right? And then week 8, week 9, we could play around with you know, because I could easily make a video for these the drugs for central nervous system disorders, and also a week 9 I'll have the final exam. But if you have an exam during that week or want to push it to week 10, please make a reservation to do so. Remember, once we're on campus, everything's by reservation, but this is a small class, so please, please, please email me. Again, this is now we're just finished your midterm exam. I'll be grading them, and also what's essentially I'm going to be looking at, did you do your discussion? Did you do your study questions, right, for intro? Did you do your study questions for dispensing meds plus discussion 2? Did you do discussion 3? It goes, and your study questions for antibiotics. And last but not least, did you do your study questions for antifungals and your study for um, the little quiz for HIV therapy? Okay, so that's and then of course your discussion 4. Okay. Now, if you're missing any of this, of course, all the late protocols are in play, but you know my adage. It is better to hand in something late than to not hand in anything at all. It is better to get some points than no points. Okay. So that's my message for MED 240. If you have any questions, you know where to find me. All my contact information is in the announcements, of course. Um, so have a good weekend, everybody. A little break in the action on me. All right. I'll see you next Thursday, 9 a.m. Have a good one.